entertainment headlines this morning. Rachel, over to you.
And you can buy her companion piece, Dr. Plastic Surgery, Barbie, you know, fix that. Okay, that's good. Relatable for women, right? Well, guys, you may have heard about atrial fibrillation, also known as AFib. Well, today we have with us Dr. Narula, of course, from MountainView Hospital, and we're talking, this is a condition that affects almost 30,000 people in Las Vegas, but yet some people aren't even aware of it, correct?
Yeah, it's amazing. The atrial fibrillation is probably the most common heart rhythm disorder, and a lot of people are affected by it. Some don't even know they have it. Others have a lot of symptoms. Some feel their heart's racing, it feels like a frog's jumping in their chest. Others just get unexplained shortness of breath. They don't feel anything in their heart, but they're just tired or fatigued all the time. And sometimes it's not diagnosed until quite late.
And you can't get help for anything and be treated unless you are diagnosed. You've got a big fancy title, but you're known as the electrician. Explain what that means.
Yes, I'm a cardiac electrophysiologist. Cardiac electrophysiology is a subspecialty of cardiology. It requires at least a couple of years of training after training as a cardiologist. And essentially it's looking at heart rhythm disorders and the electrical system of the heart.
So it's like you're like, yeah, like an electrician repairs things at your home, you repair our hearts.
That's correct. If there's anything wrong with the electrical system of the heart, I'm the guy to come to.
That's a very simple way to explain it. We were telling me about your staff is really fabulous over there at Mountain View, right?
Yeah, we're really happy we have a good crew at Mountain View Hospital. So we're able to do very extensive, very complex procedures that would, you know, it's not possible to do alone. You have to have a great staff. We have typically a couple of nurses, a couple of technicians in the room, people handling our, you know, very high technology equipment to be able to do these procedures.
Absolutely. There's one procedure specifically, it's called balloon procedure. What does this do and how does it help people have some relief from AFib?
Yeah, so it turns out atrial fibrillation in many people comes from the veins that bring blood back from the lungs to the heart. So we've been able to localize it to those areas, and the treatment available is we can actually do a minimally invasive procedure in which we thread a balloon to the heart, put it in the vein, and then freeze the vein down to -40 or -50 degrees. That freezing changes the structure of the vein, changes the electrical characteristics of the wall of the vein, and helps get people rid of AFib.
And so does the balloon then help open up the blood supply, or?
No, it's actually quite different. We're not looking at blood supply. We actually want the blood supply to stay the same.
Okay.
We put
so different than a stent, kind of.
Very
right?
different.
Okay.
Yeah, we are working on a completely different section of the heart. That's the plumber's job. This is the electrician's.
That's why I only did 4 years of school, because I'm like, you know, you gotta have a fancy title. I mean, like you said, people don't realize that heart disease and things related to the heart, it's the #1 killer among women and men. So we've got to be really aware of our breathing fatigue, because AFib is connected to the heart, and a lot of people just let it go undiagnosed, right?
That's correct. Yeah, and a lot of people just, they come because they're tired, they're short of breath, and then we make the diagnosis. So in some, you really have to do some extensive testing to make the diagnosis, because they're short of breath some days and not other days.
Sure, and I'm sure after the balloon procedure they feel great, right? People return to normal life?
Yeah, the majority of people who get the procedure actually do very well with it, and actually can go back to normal life.
Very cool. Doctor, thank you so much for the work you're doing, and tell your fabulous staff. We appreciate that as well. So thank you so much. If you have any more questions about AFib, guys, do not hesitate to call or go to the website. It is mountainview-hospital.com, and here's the phone number as well. Always make sure 702-233-5474. Thank you so much, Doctor. Appreciate it.
Thank you.
All right, now that's very different than DFib. You know, it's like clear, those machines, Jason. That's different. Totally different.
Yeah. All right, thanks, Rach. Well, 15 Vegas headliners are coming together